We have two cases for today. The first one is a female mixed breed, a small breed, 4-year-old, and the second one is a male English Bulldog, 4 years old din. They are both exhibiting dysuria and hematuria. Dysuria and difficulty in urinating, hematuria, blood sa urine, at yung isa may masangsang na amoy doon sa kanyang pag-ihi. So if your pet is exhibiting the same clinical signs, stick around because we are going to talk about bladder stones. Welcome back, guys. My name is Doc Fred. Every week we post cases, videos, topics, and tips on how to better take care of your fur babies. But before anything else, please hit the like, subscribe, and bell button so you get updated on the next videos that we are going to post in this channel. Okay? And this week, special request to we are going to talk about bladder stones. Nirequest to ng isa sa mga viewers, yung ilan sa mga viewers natin, and I've received so many messages and requests na kung pwede daw i-discuss natin yung bladder stones. Here we are. We were presented with these two cases, Isa si Phoebe at saka si Badong, yung ating English Bulldog, si Phoebe yung ating mixed breed. On with our episode, first we discuss yung case ni Phoebe. So ayan, nakita nyo si Phoebe is a 4-year-old mixed breed. Namahit na siya. Nung unang malakas daw siyang kumain, tapos masigla, and then unti-unti nilang napapansin na parang humihina na yung kondisyon. Merong blood dun sa kanyang urine, merong and when I palpated the abdomen, nakakapako na agad na merong itong stone. So we did radiographs, ultrasound, and we found out, yes, indeed, meron ngang stones itong si Phoebe, and we need to take them out, The first stone that we are going to talk about today is struvite stones. Yung struvites, nagpo-form sila kapag nagbind yung magnesium and phosphate. Struvites are actually common sa urine ng mga pets natin, and they're more common in female dogs, and they form struvite crystals. Normal lang at harmless naman yung amount ng struvite crystals, na nakikita natin sa loob ng urine. Nagkakaroon ng problema kapag na-infect ng ammonium-forming bacteria, kapag nagkakaroon ng UTI. So, ang mga female dogs are more prone to forming UTI because of the proximity of their vulva dun sa anus, Kaya sila ang mas madaling mag-form o madaling laging well-represented sa struvite stones, Usually, mga makikita natin ng mga struvites, mga middle age, mga 4 years old and above, Yun yung mga makikita natin ng mga ganitong klaseng signs. How do they form? Like I said, female with UTI and genetically predisposed to forming these stones, sila yung madaling mag-form ng ganitong klaseng stones, How is this treated? Can be treated several ways. Number one is dissolution through diet. Etong crystal na ito forms in alkaline. So, yung mataas ng pH, alkalinic environment. So, ang gagawin is i-alter yung food, gagawin acidic through diet, However, etong pamamaraan na to takes a lot of time. Kung gaano kahaba, kung gaano kalaki yung stones, at kung gaano sila kadami doon, ganun din katagal yung iintayin mo para ma-dissolve yung mga stones doon sa loob ng bladder. Maliit lang yung stones, mas ideal yung ganitong method kasi mas madali silang matunaw. By altering the pH and antibiotics, pwede matunaw yung bato sa loob. So these are one of those type of stones that you can actually dissolve. Okay, pangalawa, through surgery. Mabilis, kuhanin mo agad. Yun nga lang, it's risky because we're general anesthesia. Some owners doesn't like that. Mas maganda yung surgical procedure kung madami at saka malalaki na yung stones, Pangatlo, you can do lithotripsy in more advanced countries like the US, Canada, Australia, and other advanced countries in Europe. Lithotripsy, ginagawa na yan sa mga pets, But dito sa Pilipinas, hindi pa. Ano ba yung lithotripsy? Ultrasound waves that targets the stones and then dissolve them para maiihi na lang. Ginagawa din yan sa mga kidneys. Sa kidneys. Ginagawa ito sa tao, very common. But wala pang ganitong technology sa atin dito sa Pilipinas because mahal masyado yung machine, mahal masyado yung procedure, so the owner opt for surgical procedure na lang. Daig pa yung surgical procedure kapag ito yung ginamit. So, itong si Phoebe, pagkatapos natin gawin yung radiographs, we did some blood exams and found out na mataas yung infection at mababa ang platelets nitong ni Phoebe. So, we postponed the procedure to a few days, hanggang sa mas mag-improve na yung blood components nitong si Phoebe. And we did the surgery. straightforward lang yung removal ng stones doon sa bladder nitong ni Phoebe. Open the abdomen, prep the abdomen, prep it for surgery, open the abdomen, open the bladder, and then pinak natin yung paligid para kung sakali merong spillage of infected urine, hindi masyado maapektuhan yung ating pet, no? So ito yung bladder, nakita natin, very injected yung mga blood vessels, so it's been swollen for quite some time. Kaya nakikita natin yung ihi niya madugo din, no? Swollen yung loob ng lining ng epithelium nitong bladder na ito. Dito pa lang nararamdaman ko na yung stones. Prepped it well para hindi kumalat yung infection dun mismo sa kanya abdominal cavity. We took all the stones out and then sinuture natin ng 2 layers, put it all back, clean the abdominal cavity, and then suture the abdomen, and that's it. In 30 minutes, tapos yung procedure. Mabilis lang, pretty much straightforward, no? That's with struvite stones. Mas matagal pa yung preparation kaysa dyan sa actual surgical procedure. So a few days after, pinauwi na natin tong si Phoebe. Mas malakas na siya. Kitang-kita natin na iba na yung reaction niya itong si Phoebe at talaga nag-iba na siya. We are so happy that she has improved well. Yung next case naman natin, si Badong, is a 4-year-old male English Bulldog that was brought to our clinic because of skin problems. At saka gusto niya mag-update ng vaccines. Dinala siya kanina, supposedly for vaccination lang. At saka, meron siyang itchiness dito, meron siyang lesions dito sa kanyang balat. Ayan, no? Mumula. So, kamot ng kamot, no? And then, na-notice natin, kanina, nung napaihi siya doon sa lobby ng clinic, biglang, yung napansin namin na yung ihi niya is, has blood. Merong drops of blood doon. So, nag-worry kami lahat. We did the x-rays and found out na yung palang bladder niya merong bato, merong stones, no? So, we did the preliminary examination until they've decided na gamutin na. Diretso na natin ang surgery para matanggal yung mga bato na. Matagal na pala nilang napapansin na umiihi ito yung trickles. Ibig sabihin, iihi, tapos may stranguria, may pain in urination, tsaka iihi dito, pero konti lang yung ilalabas niya, tapos iihi ulit doon, konti yung lalabas niya. So, ganun palagi. Hindi nila napapansin because they have multiple dogs in the household. Kaya nung na-examine natin, na put up nila yung puzzle all together and found out na si Badong pala yung merong problem na yun sa kanyang pag-ihi. So, now we are going to remove those stones inside and also, ikakastrate na rin siya kasi upon seeing the radiographs, nakita natin malaki din yung kanyang prostate, no? So, this can all be connected to each other. Alright, so kakastrate na rin siya, urethrostomy to remove the stones, castrate to control the prostate enlargement. So gagawin natin sa kanya ngayon, i-perform tayo yung urethrostomy, castration, urethrostomy, and cystotomy to remove the stones sa kanyang bladder. Yung pangalawang stones ay i-discuss natin ang calcium oxalates. Iba yung itsura ng calcium oxalates. Contrary to struvites, ang calcium oxalates are formed by calcium and oxalates, no? And they are actually more common among male dogs. Male dogs. And sterile. Hindi kailangan ng UTI, no? Sterile yung condition ng urine bago ito mag-form. So, common in male dogs, adult male dogs, and usually ito yung nagbabara dun sa urethra mismo. Pag sinabi natin common in male dogs, ibig sabihin mas madami lang kikita sa kanila. Pero hindi ibig sabihin na kapag male, calcium oxalates na agad, no? Kapag female, struvites na agad, no? Mas highly represented lang sila. Mas madali siya makita doon. And formation ng calcium oxalates is because of genetic, hindi because of bacterial infection. Genetic factors play a huge role in the development of these stones, no? Ito yung type ng stones, calcium oxalates. This is the type of stone na hindi nadi-dissolve ng pagkain, no? Kaya ang suggestion dito is removal through surgical procedure, we call cystotomy or urethrostomy, no, kung nasa urethra, or lithotripsy. Since wala tayong lithotripsy dito sa Pilipinas, we did cystotomy. Si Badong, sabi ng may-ari, gusto na rin na niyang pakapun sa swak. Yung calcium oxalates, yung struvites, no, may tendency yan na mangyari ulit. Kahit matanggal mo na, if you are not going to change the environment where these crystals form dun sa kanilang urine, kung hindi mo babaguhin yung pH ng urine, magfo-form sila ulit. Especially itong calcium oxalates. At mas prone ito sa blockage. Meron na nga blockage itong si Badong eh. Na-push lang natin pabalik doon sa bladder para doon natin kuhanin lahat nung stones na nag-form. So, 3 procedures ang gagawin natin dito kay Badong. First one is cystotomy. Yung tatanggalin natin yung crystals or yung stones doon sa bladder nitong si Badong. Pangalawa is castration. Tatanggalin yung kanyang testicles. Pangatlo is urethrostomy. Gagawa na tayo ng permanent opening doon sa daanan ng ihi ni Badong para doon na sa butas na yun lalabas ang ihi itong si Badong. But before that, we did blood exams, x-rays, ultrasound, no? Para malaman natin kung fit ba talaga sa procedure itong si Badong. So, kita natin dito, kapal-kapal na ng layer ng Dito ka, Marlo, kita kapal-kapal na ng layer ng kanyang bladder na kasi from the constant irritation yan, may mga nakukuha pa tayo mga pakonti-konti na maliliit dito. They're all there attached. And we were able to flush some of them, iba masyadong maliliit. Nasa the major ones, yung malalaki, natanggalan natin, And then, so ito yung mga stones. Look, okay na. Ito yung mga stones na nakita natin dyan. Ang dami nila, multiple. Tanggalin natin. So na-close na natin itong nandito niya, yung sa cystotomy. Now we are going to proceed with the urethrostomy and castration. This is the second and third part of this procedure na gagawin natin sa kanya. You will see nakikita natin dito, merong may parang blood, kasi yung urine niya, naghiwa tayo doon sa bladder niya, So nagsasama pa yung ihi at saka yung blood doon sa loob. Kaya nakakakita pa tayo ng urine and blood. And right same day, ginawa yung surgery. Kung mabilis yung surgery sa struvite removal, cystotomy sa struvite, it took us 30 minutes lang sa struvite. Kay Badong, took us around 1.5 hours. Ganun katagal. Kasi 3 procedure yung gagawin natin. At malaki pa siya, mataba, Kaya mas mahirap at mas mahal itong procedure na ito. Okay, there are other stones that can be formed that can be found out there na makikita natin sa pets natin. May cystine, may urate. Yung ibang mga stones, hindi mo nakikita sa radiographs, kaya kailangan ng ultrasound. So, the clinical signs are pretty much the same, Dysuria, hematuria, lalo na kapag madami na yung stones na naandun sa bladder. Nagiging emergency lang kapag bumabara mismo dun sa urethra. Most often sa mga male dogs kasi mahaba yung daanan ng ihi at nagnanarrow towards the tip, no? Kaya bumabara yung malalaking stones na nadidislodge doon sa loob ng bladder, papunta doon sa dulo. Kaya this calls for an emergency. At kapag hindi makaihi ang aso, so nagkakaroon ng bigger problem, ito yung nagiging emergency case. Okay, kasi ba yung post-op? Usually kapag post-op na giniginaw sila, that's the side effect of anesthesia. Nilagyan sila natin sa warmer and try to cover their body para to conserve the temperature, body heat. And so, bantayan lang muna natin siya dito sa lumunok na. And agising na naman siya eh. Ayan siya dito. Budong! Hey Budong! Yeah! Ayan, pero ini-enjoy pa yung patent na yung patent na trachea. Kasi without it, mas hirap siyang huminga eh, no? So that will be the next na ayusin natin sa kanya. After several days, napauwi na rin si Badong. Mga dogs natin that recovered from the removal of stones sa kanilang bladders, they're still prone to forming stones. Pwedeng bumalik yung mga stones na yan if we are not going to change the diet, if we're not going to modify their behavior, no? Paano ba natin ginagawa yan? So now that you are particularly aware of what type of stones, kasi yung stone na yan, i-analyze natin, malalaman natin kung ano yan. Can easily alter. So halimbawa, struvite stones form in alkalinic environment, acidify the urine. The other one, ganun din. No? Pangalawa, we have to encourage our pets to drink more water. Yung ibang mga pets, wala namang problema sa pag-inom ng tubig eh. It's just that other dogs don't drink water enough. So, pwede naman, we can give them canned food. Canned food is rich in moisture, high in moisture, kaya para na rin silang umiinom ng tubig doon sa mismo delata. Minsan, yun nga lang, mahal. No? Mahal yung kanilang itong delata. And lastly, kailangan ng regular checkup. Every 6 months, kailangan may x-ray para malaman kung nagfo-form ulit ng stones. Maagapan natin. Habang maliit pa yung stones, maagapan na natin agad. Yung kay Badong, ang ginawa natin kay Badong, kaya natin ginawa ng permanent opening dun sa urethra niya para kung sakaling mag-form ulit yung mga stones, madali itong ilabas because there's a wider area kung saan mabilis lumabas yung stones that are lodged out of the bladder. So kung yung may mga nabubuong maliliit na crystals pa lang, madali na itong mailabas agad para hindi na siya lumaki doon sa mismong bladder. So if you've reached this point, congratulations. I hope that you've learned something new today and nakatulong naman itong videos that we posted. So if you have questions, comments, and requests, comment kayo dun sa ating comment section. Try my best to answer all of them, no? And also please, yung iba sa inyo nanonood lang, hindi naman nagla-like, hindi naman nagsusubscribe. So please hit the like and subscribe and the bell button so that you get updated every time we post videos here in this YouTube channel. And also if you have friends who are experiencing the same problems with their pets, share nyo itong video natin para makatulong sa kanila. Again, my name is Doc Resho and see you again next week.